There has been a recent upward trend in the incidence of atherosclerotic cardiovascular disease or ASCVD in the Japanese population. Previous studies conducted in Japan have suggested that early treatment with atorvastatin may be associated with a lower risk of major cardiac and cerebrovascular events in patients with a history of ASCVD or diabetes, but published data are limited. In this study, our objective was to examine treatment patterns, possible statin intolerance, and incidence of cardiovascular events in patients with high cardiovascular risk, particularly ASCVD and type 2 diabetes. Almost all high-risk patients received low to moderate statin ezetimibe doses, and approximately one-third of patients discontinued treatment within 100 days. Possible explanations for discontinuation may be that patients were either not achieving an LDL cholesterol goal or were experiencing tolerability problems. Almost 10% of the studied population had statin intolerance during the follow-up period. The inadequate statin dosage and high need for treatment intensification observed in our analysis also highlight the need for better physician understanding of intensive LDL cholesterol treatment and alternative therapeutic options for high-risk patients. Patients with ASCVD who received increased doses of statins or ezetimibe still had subsequent cardiovascular events. The results suggest that increasing the statin dose may not be enough to lower that risk and that therapeutic options and risk factor controls may be needed. Overall, study findings highlight a continued unmet medical need for primary and secondary cardiovascular event prevention in Japan.